You might have heard of depression, but have you ever heard of postpartum depression? Maybe yes, maybe no. Though it is the major problem in our country. So through this video, we will try to address the problem of PPD. So let's start.
The thought comes in our mind that I might harm my kid, I might harm my baby. ये एक Indian household we say that you're not the first person giving child. We have also given in our days. It's a very normal thing. I think why you need to be so overreactive about it. ये तो हम सबने किया है. Postpartum depression can affect a mother's ability to bond with their own child.
Hello everyone, welcome to my podcast on the series of mental health. Today we have our guest Resmi Bagchi. She is a practicing psychologist in Pune and she is also the founder of Resmi's Positive Pathway. Welcome ma'am to my channel. How are you?
I'm good, Shivam. How are you doing today?
Even I'm well. So मैम बहुत सारे postpartum depression से सफर करते हैं बट उनको पता ही नहीं होता कि उनके साथ हो क्या रहा है.
Yeah, correct. Because postpartum depression Indian घरों के लिए एक stigma बन गया. It's a stigma for all. People, women themselves, they don't know what are they going through after delivery. Post delivery, this postpartum depression. Neither the gynos tell nowadays, neither any sessions are there. So I personally am working in Pune and I'm working on this project. I'm doing a research. I've already done a research, and I'm working on how women cope up. How many women are knowing this problem and how do they cope up on this? Because many families don't support after birth. Because for them it's like everybody is going through the same. You are not different. In that case, this postpartum depression hits every single woman in a very different manner.
Exactly.
So people should know, not only the women themselves, their families should know, their husbands should know, their in-laws should know what is a postpartum depression and how to help that girl or the woman to go through this phase, because it hampers the child and mother bond as well. So for that, I am working on it and I want people to know what exactly this postpartum depression is.
मेरा पहला क्वेश्चन ये है कि पोस्टपार्टम डिप्रेशन है क्या और ये किस हद तक कॉमन है.
Okay, so the first thing is that postpartum depression is a type of depression that hits a woman just after giving birth. See, for 9 months, women's body's hormones are, changing. They are continuously changing, giving space to the child. They are, providing the child every necessary things for them to grow. So when after the childbirth, when the baby comes out, the body tends to go back to the previous stage. So that time also the hormone goes haywire. Okay. So it's different for, it's a different type of baby blues, you can say also. For some women it's milder, for some women it hits hard, and it's a very temporary emotional state of mind. And if I would like to give you an example, I have 2 kids, and when I gave birth to my daughter, that's my first child. After the birth of my child, I was not so aware of my postpartum depression, that how it will hit me. I was not aware how it would hit me, because that was my first experience. So what happened was, once while I was taking my baby in my lap, suddenly tears came out, and that is where I understood, okay, now this is something. Now this is something which is coming out. And I don't know why I was crying. I don't know what made me cry. I was just looking at my baby and it hit me. So that is what, it's different for every person, every woman. It comes within the first few days of a childbirth. And PPD is more serious condition that can affect a mother's ability to care for herself or her baby. It can occur anytime in the first year of, after the childbirth. The symptoms that I can share with you is persistent sadness or low in mood. You are not getting the energy. Tears are gushing out of your eyes. You are not understanding why. You don't know the reason. And loss of interest in appetite, in activities. You are not enjoying. You were waiting for this moment, right? A woman waits for a moment when you will see your child. And suddenly don't know, you're not having that interest, you're not getting that bond. Fatigue. Fatigue is one of the symptoms, like feeling constantly tired. See, once your baby is out, you're going through a sleepless nights, 2 hour feeds, and sleeping, burping, cleaning the poo and all. So you're going through a lot. Your body is tired. Your body is feeling very low. The body needs rest because after all, you have done a very, very big thing, that is you have given birth. Sleep disturbances are like common. That is one of the reasons also for this postpartum depression to come, because every 2 hours, depending, doesn't matter it's night or day, every 2 hours you have to get up and feed your child. Correct?
Exactly.
Appetite changes, significant weight loss or gain, because when you're feeding, it generally tends to lose weight. A body loses weight, burns calories when you're breastfeeding your baby. Okay, you're changing eating habits. Suddenly you are eating very healthy. In Indian household, we say that eat ghee more, no masalas, no spicy food. You're eating bland food. Oil is very minimum, bare minimum, and low on sodium. So multiple reasons your appetite changes, and suddenly you will feel out of nowhere there are guilt, worthlessness. When you see that many women go through this situation where they feel that I don't know how can I take care of this baby, because this is my first time. I don't want have anybody to guide me, because nowadays mostly people living in a nuclear family. You have no clue what you're going to do. You have no clue how to handle this because you have not seen somebody doing it. You don't have an example set in front of you.
Exactly.
And then difficulty bonding with baby, because it takes time to understand what the baby needs. And when once a mother is born, the first child, a baby has only one expression: either cry, either sleep, or cry, or sleep. So basically, any kind of discomfort the baby is having, he or she will cry, and the new mother doesn't know how to deal with it. So she will think, is this something? Is this stomach pain? Is this ear paining? What is happening? So these things, made I'm not worth of being a mother. I don't know what to do. I really don't know how to do this. That is where you break down. That is where your family comes into picture. That is where your family support comes into picture. Your husband's support comes into the picture. They say that husbands generally nowadays say that I don't know how to handle a kid. So does the mother. You have to be supportive. You have to be, your wife should know that she has your back. You have her back. It's a team play. Okay.
True.
So, and the mother always in that situation tends to panic, especially in the first 3 months. And the thought comes in her mind that I might harm my kid. I might harm my baby. So in that cases, these are the severe cases where the mother tends to, push their child away. Frightening thoughts of harming my baby will make me, won't help me bond with my child, because you don't know what you're doing, basically.
True.
So that is where the anxiety, panic attack comes. So now if somebody is there who sits beside you and just, I'm there, don't worry. You're doing a good job.
Everything will be fine. Exactly.
Everything is okay. It's a baby. It's your baby. You will understand. I know you're doing a very good job. These words matter. These words matters a lot. You automatically feel that confidence. No, I am the mother. I have to do it. I can do it. Yes, I can. You get the confidence back. You can cry. Because you can cry in front of people. You can cry in front of your husband. Husband should be there. It's okay. It's okay. I had this feeling and I was crying. So my husband came in and he's like, what happened? And I'm like, I really don't know what to do and how to do. And I myself, I'm not mentally ready, that I have a very big responsibility ahead of me and I don't know how to take care of it. So that is where my husband told me one single thing. It's okay. साथ में करते हैं ना. We'll do it together. It's okay. It's not a big thing. It's ours. हम गलतियां करेंगे. We'll make mistakes. We will learn from our mistakes. It's okay. We no parent is perfect. Our parents were not perfect. So you can't imagine. Don't take the stress or burden of being the perfect parent. So it's okay. They are learning how to grow. We are learning how to be parents. So it's okay. Those words, those words, it made a magic in my subconscious mind. And that magic helped me through this journey. So having somebody's back, be it your mother, be it your best friend, be it your husband, be it your in-laws, matter. It do matter.
Exactly. Now, what will happen if the woman will not get the support of the family? What can be the consequence of it?
She'll break down. She'll mentally break down. She'll have anxiety or panic attacks. She can lose interest of bonding with her child. She will stop taking care of herself. And the worst part is that she'll continuously feel this, she'll have this feeling of worthlessness. You know, fatigue will make her lose interest in activities like taking care of herself. Some you like single mother, or in a nuclear family, a mother where the husband has to go to office. When you have a child, and especially in case of second child, a mother forgets to comb her hair daily. She doesn't have the time to take bath. She is constantly, she's in a fear ki if you even have a maid or house help, okay, you will constantly be in a fear. What is she doing? What is she doing? And this is not a myth. It's a very true fact that every mother, when they go to shower, they hear their baby crying and they're like, "Mera bacha to nahi ro raha hai. Is my baby crying?" The constant fear, my baby's crying, my baby's crying, my baby's crying. So this thing eats you up from inside. And if you really, it's very unfortunate, but it's possible that a few ladies after giving birth don't have the family support. In that case, to approach a psychologist or your gyno, you need to approach them. They are the best person with whom they can share. A gyno will generally tell them that you need to contact a psychologist. Psychiatrist, no, because in case of a severe depression or severe, anxiety attacks, that is where a psychologist tells you to go to a psychiatrist.
Okay.
Because their medicines are involved. You need medication. But not every mother needs medication. So psychologist is a safer option where you can come, you can, talk whatever comes in your heart. A psychologist guides you. And if she understands, yes, this is in a different level, she will personally tell you to go and visit a psychiatrist. So you can always have the option of talking to a psychologist when you don't have anybody to talk to.
So, how can psychologists help a mother? Like, will they give a therapy, counseling? What are the structured process that a psychologist can help the mother?
Basically, in these cases, to understand what the person is going through, or what the person's perception is, or what are the fears are. First thing that a psychologist will do is a talk therapy.
Okay.
She will want the person sitting in front to open up. You have to open your heart up. You have to tell every weird thing that comes in your mind. You know why? For a psychologist, nothing is weird. Everything is normal. Everything is okay. Because we are sitting here to make things okay for you. So
Exactly.
you don't have to think before talking to that. Will she judge me? Will she think low, bad of me or something? No. This is your open space. When you're sitting with a psychologist, always have first thing in your mind is that this is your open space. This is a private conversation. Nobody will judge you. Nobody will judge what is right or wrong. Nobody will ask how can you think about it. No. Just because you have some fear or some thought in your mind that you cannot process, you go to a psychologist. And we are there to listen. We are here to sort out. We are there to help you find out the path, the correct path. So the first thing, a basic thing that a psychologist will do is a talk therapy. Is to understand what is bothering the mother, what is bothering the bond. How can we help the mother? to come out of this, state of mind. It's not a trauma. You have given birth.
Exactly.
It's a very, very
Exactly.
miraculous thing that you have done. So the only thing that requires is that we are there to, we have your back. That's what matters.
Hmm.
That's what the psychologist will do first. Depending on the
Awesome.
severity, we will tell them what to do next. Depends on the severity
Hmm.
of the, condition. We will take the steps or ask them to visit a psychiatrist in case medications are required.
Hmm. Ma'am, but especially in India, women are surrounded with a lot of stigmas around mental health, PPD, and what are those stigmas and how can they overcome those stigmas and approach psychiatrist or psychologist?
The stigmas that I have seen is like, it's really sad. Frankly, if I'll tell you, it's sad from my behalf because nowadays we all are going towards literacy. We all are
Hmm.
mostly in Pune. If I'm saying I'm based in Pune, so in Pune, I'm seeing that my the population is mostly of literate also, but I'll not say literate or illiterate here. Why? Because this perception, many people, many women don't have, being working in a corporate environment, they are not aware sometimes, so this is something which, the stigma that they have is that this is nothing, it's okay,
Hmm.
it will go away.
Exactly.
You need to talk.
Hmm.
You need to talk to anybody that you're having these feelings. You're having some kind of feelings that you feel is not normal. That is the most basic stigma that a woman has. Okay. The
Exactly.
second stigma is that if I talk to someone, what will they think? So that is where the family's help comes. You can't be judging.
Exactly.
Third stigma that the woman has is that the in-laws or the family. ये एक Indian household we say that you're not the first person giving childbirth. We have also given
Hmm.
in our days. It's a very normal thing. It's a
Uh-huh.
natural thing. Why you need to be so overreactive about it? ये तो हम सबने
Exactly.
किया है. ये हमने भी बच्चे पैदा किए हैं. These things, this stigma is really sad because every child is different. Every mother's experience is different. So you can't say that कि हमने भी किया है, कौन सा बड़ा तीर मार लिया है. No, it's sad. Please, 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 I request never to use these words in front of a mother who is going through a lot. They are going through physical changes. They are going through hormonal changes. They are going through mental changes. Brain enlarges once you are during your pregnancy because they are also working hard. Your heart is pumping double the blood, so the brain also enlarges. So
Hmm.
once things are going back, the internal is working equally. Jitna she's tired, she's working double. She doesn't have
Right.
time to rest. She doesn't have time to take her own sweet time to even comb her hair. She doesn't have. Many women don't have. So these all words is really disheartening for the woman. Yeah, why am I reacting like this? Why is it happening with me? It's okay.
Hmm.
It's okay. It's not rocket science. It's something your body is going through a changes. So is your mind. So this is where you need to understand. Your family needs to understand. Another stigma is, matlab this very rare. But when
Hmm.
the woman after birth starts crying badly, they try to, you know, uh, many cultures have this. They seclude the person with the baby. They seclude the mother with the baby. They'll close them in one room. Don't let others to go inside that room. Very, very less visitors for the, first few months. They will not let you sleep in a normal bed. You will make you sleep in a khatia. You know what khatia is?
Hmm.
So in the
Yes. Yes.
khatia, okay. So they will make you in hot summer. They'll tie up your head, make you wear sweaters, let you eat something that you're not willing to eat. So this is something I feel before doing such kind of practices. talk to your gynecologist, because I know your gynecologist will be the best person to guide you what is required, what is not required. When you're giving birth in summers, you're tying your head. You have some reasons for that. Every family does. But nowadays, that reason is not valid. So, what you want to know, that my family practices this, your gyno is the best person to guide you what is required and what is not required. So, I'll not say anything against any culture that is good or bad. But when you put a woman secludedly in that kind of situation and she's spending more hour alone, she will feel low. She will feel depressed. She will have very weird thoughts in her mind because of the lonely feeling. The moment I have given birth, I'm alone. I'm feeling so low. That is where you need people to talk to. That is the time where you need people to, uh, you know, be there for you. She's there for me. That is required. That is, mental health is as important as a physical health. Support is the basic thing that can do for a new mother as a family. They need you. They need your support. And few stigmas are there, like baby massage. तेल से ही मसाज करना है, बेबी को रैशेस आ रहे हैं तो भी तेल से मसाज करना है. अगेन that gives a mother ki yaar a child is crying during a massage. For the family it's a healthy thing, of course it is. But if a child is crying, there might be some reason, because few children, they take the massage very nicely. My daughter used to take massage very nicely. She used to feel relaxed, her eyes used to close like this. So I understand as a mother, okay, she's enjoying it, so I'll do better next time. When my son came, he's my second child, he used to cry horribly during the massage. He will not let me touch his head. He'll do like this, like this. He'll show all kinds of discomfort. That 1 month old baby. That is where I consulted the, pediatrician. That is where a skin specialist. I have a friend who is a skin specialist, Dr. Ankita. She told me it's not necessary to oil the baby or malish karna. It's not important at all. You try do that with the moisturizer if your baby's body is not taking that oil. If rashes are your rashes, you don't need to do it. It's okay. So whatever you think, consult with somebody expert who is a pediatrician or a gynecologist when you do such kind of practices. So all I am saying is that these stigmas are still there in Indian household.
Exactly.
When you feel that is it correct or not, talk to the expert. It's related to you, talk to the gyno. It's related to your baby, talk to the pediatrician.
So what can be the treatment for postpartum depression?
So for the postpartum depression, the treatments that we suggest is first is therapy and counseling. The first thing that I said is talk therapy, especially CBT. CBT is cognitive behavioral therapy. It's how we understand the condition of that lady who is sitting in front of us. And through CBT and through talk therapy, we try to bring out, CBT is very, very helpful during this postpartum depression, is because the belief system that you're having, CBT changes it. CBT will understand your things that are going in your head, and we will just change it, make you look the different perception. If you're negative, we will try to make you positive. We will change your perception. CBT is very helpful. And, we can help women manage them emotionally, psychology. Educating a woman about the postpartum depression beforehand also helps. Before the birth, letting them understand what is postpartum depression, how it can hit you. It's like you're mentally prepared. So what happened with me? I knew, okay, the tears, okay, something is starting. Something is unusual. Now I need to talk. Why? Because I knew. I was educated. I knew what is PPD. So talking is must. Educating yourself is a must. Then if you see, depending on the severity, medications like antidepressants, such as, there are multiple type of antidepressants which will not harm your baby. So a psychiatrist will guide you through that depending on the severity of the problem. There are many support groups also that you can find online. Many support groups. Support groups is a group of mothers who all are new, who all are new mothers. Some are within 9 months, 1 year, 3 months, 2 months. So they help each other. That is where they share their experiences. That is what a support group is. You can do that within your societies. You can do that within your friends. There are social media platforms where you can do the same. Social support. That is what we say. And the third thing is that self-care. Ensure adequate rest. Take help. It's okay. Take help from your family. Take help from your friends. Take help from your husband. Don't feel कि if I take help, I'll be less. No. This is the time you should, हाथ बढ़ाओ तो हम हाथ पकड़ेंगे. This is the time.
बिल्कुल.
And when you understand, many ladies are there, many females are there who are not like, they're self very much, they are very self-sufficient. They don't have the habit of, breaking down in front of somebody or asking for help. For that kind of ladies, I will say, it's okay. It's okay. This is the time where you don't know what you're going through. Your body doesn't know what you're going through. It's okay to talk. We are there to help you. We are there to support you. It's okay. You're doing a tremendous job. It's okay if you, give me your hand. I'm there to help you. So it's okay. Contact a doctor. Contact a therapist. Talk to them. Contact a friend, a family member, anybody who you see. But do take support.
And how does proper diet plays a role in PPD?
Diet, please, because see, it's nothing. It's diet here comes is because when you are going through physical changes, once the birth is done, the baby has gone out, the organs that have shifted up, they will come back to their own positions. So the hormones are doing their work in, making things all right, okay, just like before. So when the hormones are working, your brain is working. When your brain is working, your brain neurons are working. So diet there plays a very big role because you are helping the body with additional supplements. The most important thing that a doctor, gynecologist gives you after a childbirth is vitamins, iron, calcium. Okay? These all are there to support the body with extra things. Now, if you eat spicy that time, for example, why diet is important? If you eat spicy, your body is going through different changes. You might not digest that. You cannot digest that. And that somehow, whatever you eat comes in your milk, and the baby also gets. I'll just give you my example on this, because I had a cook during that time. My parents were there, but my mom is not well, so I had a cook that time. So she did not cook differently for me, and I did not know that time that okay, less spicy. So okay, everybody used to have less spicy because of me, but less oily part I missed on. That my brain missed on. Because that time you are forgetful. You are going through a lot of things at one time. Baby's food, baby's rashes, baby's body, baby's skin, baby, you yourself. Exactly. So you tend to forget. Okay, your mind tends to skip few things. I skipped that oil part. I forgot to tell the maid that, bhai, ya to you cook differently for me. If not, then cook with less oil. And cooks. One day, my daughter was, I think, 25 days or 30, like 1 month nearby. When she was in her poo, I saw oil, mustard oil. That is where that is where I realized, oh my God, I need to cut down oil. I need to cut down oil. That is where my husband came for support. That I will cook her food. I will cook and go. She will eat it in the lunch. I'll cook and go. Or my father was there to support. In during my lunch, my father used to cook for me. I had for 3 months. I did not eat oil. My food was cooked in either ghee or boil. Again,
Hmm.
in boil, milk is important because you are also feeding a baby.
Hmm.
Spinach helps your bones because spinach has more calcium than milk. So it helps your bones. So basically, when we think that supplements, medical supplements, helps your body, no. Medical supplements not only helps your body, it supports your brain also. It helps your brain also. It helps your body. It's all interrelated. So that is
Hmm.
why once you are discharged from a hospital, a good hospital always gives you a diet. I had dietitian giving me a chart before delivery, but just because I told you it skipped my mind. So that is when I took out the chart. That is when I took out the chart and I gave it to my family and I said, "This we need to follow strictly for me."
Hmm.
So a diet is must not only for your body, your brain also. Your brain gets that important, uh, you know, supplements from your body. So if you give the diet or the proper supplement to your body, the brain will take it from it. The brain will absorb from there, and it will help and support your body.
Hmm.
And the most important thing is that whatever you eat that time, your baby is getting the nutrients from there. So you
Okay.
have to eat healthy for your baby.
Exactly. What are the things women can avoid during the time of PPD?
Few things that a woman should try and avoid consciously, unconsciously, that is overload yourself with tasks. Don't overburden yourself. Don't overload yourself with tasks. Why? Because you're going through 2 hour feeds, diaper changes, cleaning your kid, cleaning yourself, multiple things. Try and seek help. Okay? Try and seek help from your family or a maid. Try and seek help because it requires you need to sleep. Those two
Hmm.
hours when your baby is sleeping, you should sleep. So don't overburden yourselves with those tasks. ये जो सोच है ना कि I can do it, I am self sufficient, I don't need any help. Don't. This is the time your body, your mind needs help. So don't overload yourself. Second is isolation. Don't go into isolation stage. If your family sends you there, so what I said that cultural practices are there, they isolate the lady and the baby. Talk to your doctor, talk to your gyno. They will tell you what's best for you. Talk to your pediatrician. They will tell you what's best for you. Take help from the experts. Don't go into isolation. Talk. Be happy. Do see things that makes you happy. That takes your mind off what is going around you. जैसे for example, I'll give you my personal examples. For example, during my first child, my daughter used to not sleep at night. She was a night owl, and the only way she would sleep is she would sleep in my lap. She will not sleep on the crib. She will not sleep in the chula, and she will not sleep in the bed. So every 2 hours after feeding, I will take time and put her to sleep, and then I can't put her down.
Hmm.
So the only option stays is that if she's sleeping, she'll sleep in my lap. Now I'm
Hmm.
sitting whole night. So few days it was like a trauma to me. I was like, I'm tired. I need sleep. I can't. मैं ऐसे सो रही हूँ. I'm sleeping like this. So it's my body started aching. So then I decided. My family was here. My parents were here. So I told my mother was not physically well. So my father. So we divided the time. So I will feed every 2 hours. and I'll sleep when the baby's sleeping. So in the day, like till 10 to 11 o'clock, my husband will carry the kid. My kid will sleep throughout the day. Okay, she'll sleep in the crib, she'll sleep in the swing, but at night she will not. So from 10, my husband's duty was till 12 or 1 o'clock. Then he will give it to me for feed only. And once done, he'll go to sleep. So from 12 to 1, my duty used to start. So that is where I know that I have to feed every 2 hours. So I used to put alarm. See, for example, I have started feeding at 2 o'clock and I have finished feeding by 2:10 or 2:15. So I will put an alarm for 4:15. So 2 hours from the time you finish feeding. So I'll put an alarm. And now I have 2 hours in my hand. So I know I have to sit with her. So I'll watch a movie, I'll watch a series. Okay, so I'm taking my mind off. I'm not burdening myself. Oof, I'm so tired. I need to sleep. What is happening to me? Why is she not sleeping? I'll not do that. I'll utilize the time for watching a movie, watching any series or something till 4 o'clock. 4:30 my feeding is done. My father's duty used to start. He will take the kid and he'll go to the sofa and he'll sleep like this for some time. And 6 he'll come back to me again and he'll say, now it's your turn. So I'll feed the baby. And next, I have slept for that 2 hours. Every 2 hours, I have to wake up and feed at any cost. So once I'm done feeding this, changing, cleaning her in the morning, and then I'll give it to my mother, and then again I'll go to sleep. So that is my whole family distributed this responsibility. So that is where isolation is dangerous. You don't need to isolate yourself. The whole family plays a part. Then is that ignoring your mental health needs. Why to avoid trying to push through without addressing your emotional needs can delay recovery. You're trying, no, I'm okay, I'm strong. I don't need this. This will delay your recovery. Your body, your mind will get tired. Your mind will get tired. Your body will also, suffer the consequences. PPD is a medical condition. जैसे body has problems, वैसे mind also has problems. जैसे body needs help, mind also needs help. So PPD is a medical condition that requires attention. And just like any other physical illness, you need to pay attention to it. It's your mind. You need to keep it clean. And, suppressing emotions, stigmatizing, you need to avoid it. Why? Bottling up of feelings and sadness, guilt, anxiety. Because societal जो stigma होता है, societal stigma can make PPD worse. Bottling up things that if I cry, my in-laws might judge me. I have to listen कि हमने भी बच्चे पैदा किए थे. No, don't bottle up things. Tell them, I need help. Say, I need help. Okay. And often, there's often shame attached to the feeling. Like, you are not enjoying motherhood. So, I'm not enjoying motherhood. How shall I tell somebody कि मुझे नहीं अच्छा लग रहा है? It's okay. बोलो. तब तो people समझेंगे कि you need help. These feelings are very common in PPT. These feelings are very common in PPT. And what you can do instead, I'll say that also. Allow yourself to feel those emotions without judgment. Okay? Talk openly with a supportive person. Anybody, as I said, a friend, a sister, a sibling, husband, mother, in-law, anybody, support groups, any professional. Psychologists are there always to help you go through this PPD. Okay, they can help you go through the process of feelings, process your feelings, CBT, that is where they come. They will help you process the feelings. You will turn you from negative to positive. And remember, PPD is a medical condition, not a reflection of what a mother is worth. It's not a reflection. So don't worry, open up. And again, excessive social media use. Oh my God, don't do that. Don't. Everything you're googling nowadays, mothers tend to google every symptom they go through. Won't do that. You'll fall. You'll puzzle yourself. you know Social media can create unrealistic comparisons or highlight other people's perfect motherhood experiences. See, I'm crying here and I'm into a social platform. I'm like, wow, I'm enjoying motherhood. No, every single woman is crying. Trust me. Every mother is going through a tough time, especially the first time mothers. Second time mothers, they actually know how it goes, but they have additional problem of the first child. If you have to see first child also, you have to see the new one also. So your attention is divided here. So the second mother also requires help as a first mother. Okay, and what you do instead is like limit social media use. Okay, take breaks, take breaks from it. Focus on positive support activities. Do meditation. It helps. Trust me. Listen to music. Music itself is a therapy. You don't need to go to anybody. Listen to something that helps you, and it helps your babies also. There is an experiment. There is something that I tried during my, uh, uh, you know, whole pregnancy period. That is few songs, be it mantra, be it om, be it any TVT and chants, you keep on listening at night, but that is where the baby is, thinking. Suddenly a motion is going on, your body is moving, you're working, you're doing something. Suddenly at night everything is silent, you are not moving. So your kid becomes active. कि क्या चल रहा है, क्या चल रहा है, क्यों इतना शांति क्यों है? Why is it so silent? So the kid also, inside your stomach, the kid is active, thinking, figuring out why is it so silent? Why my mother is not moving? What is happening? So that is where, listen to a music. A kid listens in your belly. So the same music, when the baby's out and you put on the same music, the kid automatically calms down because the kid feels that, okay, I'm familiar to this sound. I'm familiar to this environment. The kid calms down. So this music therapy is very good thing. It also helps the child's mind to develop. It helps the brain's neurons to develop. Music is very powerful thing. So listen to good music. Doesn't require to be any religious song or something. Anything that suits you. Plain music also suits your mind. Just you know, Mozart. I used to listen to Mozart because there is a saying that Mozart helps building your child's brain. So those Mozarts help me make my child sleep at night. Mozart chalaya, bachcha shant. The baby is silent and he's like this, and then slowly he closes his eyes. So Mozart, it will not happen in one night. It will take time. Listen to music, limit social media usage, limit or avoid Googling your symptoms. Talk to some expert. And don't try to do everything by yourself. Don't try to do everything. I can do it. Don't do it. Take help. It's okay. And family communication is must. Communicate with your family. Tell them you need help. If they can't help, if your in-laws or your parents cannot come, husband has to go to office, look for house help. Get a maid. Ask your parents to help for that. At least help you financially for a maid if you are not financially, or tell them that send me a maid 24 घंटे वाला. Take help. Take help. And stop criticizing and blaming yourself. You are learning to being a mother. You're not expert. This is not your fifth child. You're learning to be a mother. So you will make mistakes and the mistakes are okay. Just remember, okay, realize that this is a mistake. I'll not repeat it. Never a mother tends to repeat them. And don't avoid resting. Don't avoid sleeping. The moment your child is sleeping, go to sleep. Leave everything on earth. Sleep, 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 sleep. If taking bath helps you, do that. But sleep, get ample amount of rest. Whenever a child sleeps, a mother should sleep. And Don't set unrealistic expectation from the social media. Don't do
Hmm.
that. You know, unrealistic expectation is like, I I am a mother now. I should be perfect. I am a mother now. I should do things perfect. No, it's okay. Messy is good. It's okay. It's okay. Messy is good. क्या होगा? थोड़ा ऊपर नीचे हो जाएगा टाइमिंग में, but it's okay. Everything. Just understand one thing. I'm learning to be a mother. I'm
Hmm.
learning to handling two kids, because the second time mother also or third time mother also is trying to juggle two kids and the family and the responsibility. So
Hmm.
it's, you will make mistakes. Learn from them. If you don't make mistakes, that's very good. But if you're making a mistake, you're not a less of a mother. You're perfect. You're perfect. It's okay. And the main thing is that any substance abuse, alcohol, as every doctor says, no,
Hmm.
no, no, a strict no. Bottom line is that a journey through postpartum depression can be challenging, yes, but with the right support, with the right compassion and treatment, you can recover. It's okay.
Hmm.
Don't take it as ki it's normal. No, it's not. Every woman has a different way of handling things. So you have to
Hmm.
understand, yeah, this is about to happen. Be mentally prepared. Talk. That is the basic thing. Listen to music. Talk. By avoiding these things, you can worsen PPD. Thinking that, no, no, I'm okay. I'm perfect. I'm strong. You are strong. That is why you are a mother now. You have gone through
Hmm.
something with a, a male person cannot go through. You have gone through all those things. So it's okay to take help. And addressing your needs is doesn't make you less of a mother. Sometimes you should prioritize yourself as well. You should
Hmm.
tell your husband, do take care of the kids. I need to have a nice warm bath. I need to take care of myself. It's okay.
True.
First 3 months is the struggle. Slowly you will everything will fall into places accordingly. Just give it some time. Okay.
True.
And if you ever feel overwhelmed or unsure, reaching out to a healthcare provider like a psychologist, a gynecologist, a pediatrician is the first step forward to recovery. You
Exactly.
don't have to navigate postpartum depression alone. So now, Shivam, I want to say something about, you know, something baby blues and
Hmm.
postpartum depression that I I am sure that mostly people are not aware of it. What is baby
Even
blues
I'm not aware of it.
and what is
Exactly.
postpartum depression? It's a very different thing. So
Hmm.
it's normal for many new mothers to feel emotional, weepy, crying. Like I said, I was weepy once, or anxious after childbirth, especially in the first few weeks or two. This
Hmm.
is often referred to as baby blues.
Okay.
This is often referred to as baby blues, and it resolves itself within 1 2 weeks.
Hmm.
Weepy, crying, feeling low. Baby blues are symptoms that are mild, typically fades away by its own with some emotional support or with somebody just knowing that I can
Hmm.
cry in front of my own people, and it goes away by its own. This is baby
Hmm.
blue. This is not postpartum depression. Now let me tell you postpartum depression.
Hmm.
Postpartum depression is more intense and can last longer. You're seeing that it's 1 2 weeks are gone and still I am not I'm not you know I am continuously feeling depressed and I'm questioning myself and I'm not taking care of myself and I'm feeling lack of interest or taking food or anything in taking activities. That is where you need to understand this is not a baby blue. This is a postpartum
Hmm.
depression, and it's more intense. It can last longer, it can last for several months, and it may interfere with daily functioning.
Hmm.
Weeping,
True.
sobbing, crying, baby blues. Things go intense in postpartum depression. Baby blues, you just need to have, you know, calm yourself, listen to music, talk to somebody. You will say in 1 or 2 weeks it's gone. But when you're singing that this condition is persisting for a long time, it is not helping you, it is not going by itself, that is where you need to take a professional help.
Hmm.
In, postpartum depressions are symptoms that are more severe, longer, interfere with your daily lives and functioning. Impact of postpartum depression is, if untreated, postpartum depression can affect a mother's ability to bond with their own child and may lead to difficulties in a relationship with her parents or partner or family. You know, irritated, agitated, shouting, loss of interest,
Hmm.
reacting in small incidents. That is where you should understand the person needs help. So, in
Hmm.
some cases, it also leads to long term emotional challenges. Sometimes it can lead to bipolar disorder. And for both
True.
mother and the child, the bonding, somewhere there is a gap between the child and the mother bond. And early intervention and support can significantly show difference and recovery also in well being. So, once you're seeing that 1 2 weeks where things are not turning to normal, try and
Hmm.
seek help. So
True.
I for as a conclusion, I would like to say that postpartum depression is a serious condition that requires attention. Baby blues, you will understand that you are feeling low, you are feeling weak,
Hmm.
you are feeling tired, and it will go by itself within 1 or 2 weeks. But when you're
Hmm.
seeing things are going in a severe state, severity of the situation will make you understand that this is not baby blue, this is a postpartum depression. Always do talk to someone in that cases.